All right, welcome to Scoliosis Dialogues. I'm Chris Hardesty, and today we're talking with Megan Johnson and Bob Cho about their fellowship experiences. So let's start with Megan by introducing yourself and telling us about the fellowship you traveled on.
Yeah, so I'm Megan Johnson. I'm currently at Scottish Rite in Dallas, Texas, and I received the Karol Women in Spine Award, which is a traveling fellowship that allowed me to go to a few different places and to observe some surgeons. And so I chose to go actually to 3 different places. I wanted to learn some more about the sagittal plane and 3-column osteotomies. So I visited Mike Kelly at Rady Children's in San Diego. I went and observed Larry Lenke in New York, and then I went to the Philadelphia Shrine to observe Amar Samdani.
And Bob Cho, will you tell us about yours?
Yeah, hi, Bob Cho. I'm in private practice in Los Angeles, and I was on the G. Edgar Dawson traveling fellowship, and he is from LA actually, and so I felt pretty honored, as an LA representative. I got to go see the Moores in Wilmington, Delaware, with Sukin Shah, Will McKenzie, Pete Gabos, really the 3 of them mostly for the spine stuff, and it was pretty awesome.
Okay, today we're going to talk about what these guys saw, what they learned, and how their journeys are shaping their practices. And hopefully we'll get a few fun travel stories along the way. So your first question is, what stood out to you about how scoliosis care was approached in the places that you visited?
Yeah, so I think for me, at every place that I went to, which was 3 different institutions, I really appreciated their very thoughtful care to each patient and how they planned for the surgery, how they sort of talked with their team taking care of the patient, and there was just very streamlined, very thoughtful at all the places, though different, and actually seeing how Larry sort of approached adult patients with scoliosis, which I don't have a lot of experience with, was really great to see, and I think it reinforced taking the time to sit down and thoughtfully plan out these surgeries. And I was impressed by how their teams also functioned really well. They had sort of a pared down team that took care of these patients, and just really impressed by each of them and how they think through things.
I'm sure that thought process is so invaluable because you get the time to focus on it while you're with them.
Yes.
And you can't always take time in your own practice to do that.
Yeah, I think it's valuable to be in the OR and watch how they do things, but I think for me, just sitting sort of in their pre-op conference or going over cases and just sort of observing how their brains think through cases was really, really valuable.
One of the great things about the reciprocity of the SRS Traveling Fellowship is that for those centers, that's probably also a time for them to reflect on what they do and how they do it. How about you, Bob?
Yeah, so I agree with Megan. I think the masters in spine surgery, they're really good at managing people, place, and time. And they're, it's the management of the team, but it's kind of like being a conductor in a symphony, and, everything is going at the right place at the right time and very efficiently. So seeing how they did that was awesome. I really love teaching as well. And so I really loved how they incorporated the fellows into surgery, kind of the wraparound teaching, before, during, and after. I'm a big believer in post-op debrief, and their post-op debriefs are pretty significant and regimented, and really great experience for the fellows. As well. So I learned a little bit about how they did that. And then just, I got to go into clinic as well. And I really enjoyed seeing, you see the people on the podium, you see the people giving the research, but then just seeing them with the patient and, the type of empathy and, humanity that they have, and how they approach kids of different ages and parents who are scared. It was really enjoyable to see that.
Morris has quite the team.
They really do.
Yeah. Okay. Was there a particular technique, technology, or philosophy that made you rethink your own practice?
Yeah, I mean, I think for me, the sagittal plane, has obviously become a major focus in the last, 5 years or so, and it's something that I think I really need to be immersed in to sort of understand it, and I would love to be able to incorporate more of it into my practice. And so for me, going and observing Mike Kelly and seeing how he uses some of this AI type of software to plan surgeries out and patient-specific rods was the thing I was sort of really interested in learning about, and is something that I definitely want to start using in my own practice. But being able to see somebody incorporate it into their daily practice for really a variety of very different cases, and then being in clinic with him for a little bit and seeing how he applies it just on a patient-to-patient basis on the fly in clinic was really, really amazing, and it was a great thing to learn from. So I would say that's what stood out to me.
So one of the cool things is they had just gotten a robot at the Moores, and just I had seen in the past Mark Erickson use a robot, and he's about 500 cases in on the robot, so absolute master at it. Obviously Suk and Pete and Stu are master surgeons as well, but they're in the beginning of their learning curve, and just I haven't yet adopted a robot. And if I do, I'll name it something cute, I'm sure. And it just to see how they're starting to bring a new technology into their practice, which is going to be beneficial, but there's obviously a learning curve, and there's time loss, there's other things. So seeing that actually I think was really good, because that will help me in like how I'm going to bring something like that into my own practice. So I really like that. And then also Nemours is very, very famous for taking care of little people. And when they asked what kind of cases would you like to see, I was like, I'd like to see some, cases for little people. And so they had, Stu McKenzie had a VCR on a very small person with very small pedicles and canal, and just seeing some of the tips and tricks on how to manage a very, very difficult surgical bed. That was very cool.
I will say the other thing for me too was I think sort of the Philadelphia Shrine is similar to Scottish Rite in that it's a very narrowly focused hospital and it's smaller. They have actually a functional ICU at the Philadelphia Shrine, which was really fun to see because we don't have that.
Right.
I think sometimes it would be nice to have something like that. So it was great to sort of see how they use that in their practice and how they incorporate intensivists and hospitalists to help take care of a lot of these very complex patients.
You really have to have a great relationship with your ICU.
Yeah.
Sure do.
They can be partners.
Yes.
Well, SRS Traveling Fellowships are equal parts education and relationship building. So, but outside of the OR, what cultural experiences stood out for you, or were there any really memorable moments?
The thing that was really memorable to me actually was when I was going to visit Larry. He asked me if I wanted coffee, and I guess I assumed he was going to stop at a Starbucks on the way and bring me a coffee. But and so I said, "Oh, I'll take a latte or something fancy." And he said, "No, I'm just going to bring it from home." And so I was actually I was so impressed, and it was wonderful. He brought me like a whole travel mug of coffee from his home, which was really very sweet and kind.
Warren Buffett of him.
Yeah.
Yes, and thoughtful. And I was like, I can't believe I'm drinking one of Larry Lakey's coffee cups from home.
Did you give the cup back?
I did.
I would
give
have
the
stolen
cup
it.
back, yeah.
I would have totally taken that as a souvenir.
I gave the cup back.
You're nice of me. So I think what was cool being at the Moores, they have a Philadelphia area spine meeting, and when I came, it coincided with that. And so after we had done some cases in the OR, we got an Uber, went into Philadelphia, and met with the other hospitals, other fellowships, CHOP, Shriners. But anyways, it was and just just seeing like they have a monthly meeting where they, talk about cases, and it's really fellow-centric. So that was really just cool to see like a citywide initiative like that. I'm from Philadelphia originally, so it was just good to see some of my old stomping grounds as well. I did not get a cheesesteak. I was very sad.
Did you walk away with any Eagles gear?
I don't need any more.
Okay, good. So the SRS obviously offers lots of different types of traveling fellowships. What advice would you give future surgeons considering your specific fellowships?
Well, for me, I think that, especially as a woman in a field that's traditionally male-dominated, it can be really intimidating to try to walk up to somebody and talk to them about their practice and even broach the subject of like, can I come visit you? And I think this, the Lori Karol Award specifically sort of gives you, empowers you to be able to do that. And what I learned was that everybody is incredibly welcoming and humble, no matter how intimidating they seem up on the podium and in their practices. And so I think this was an invaluable experience. I think going to see how other people are doing things, no matter how far you are in your own practice, is a tremendous opportunity, and you should have zero thoughts about doing it and just apply and use that as your sort of platform to then get in touch with these people who you want to see how they practice and just go for it.
This really is a perfect way to honor Lori's legacy.
Perfect way. She was always so welcoming and so all about bringing up junior people and
being approachable
and raising them up and being approachable. And I think this, in the spirit of that, should empower other women to use their voice and get out there and spend time with who they want to spend time with.
Yeah, I got to give my own Lori story. So like Lori is the first person, like famous person in our society that recognized me, and I remember when she came up to me and, she's Lori Karol, and she's like, hey Bob, I'm like,
you know my name?
What? And my tag says Robert, so I know if you don't know me, you say, hello Robert, it's like, the only people that call me Robert are my mom and Dennis Wenger. So I think she's exactly that. She's all about empowering young people to get, kind of come up in society, and I just, I miss her. So anyways, as far as considering a fellowship like this, I think, Chris, you went on a traveling fellowship with SRS, and that's a big commitment away from work and home. That's hard to do for a lot of, exactly. That's hard to do for a lot of people. I think the nice thing about the Dawson fellowship, it's a week, and that's pretty easy for most people to do, to take away from home. So I think that's really nice. I think if you're going to look at these, remember these are all time limited, and it's not like you apply and you're going to get it like first shot. So I would say apply early and often. And if you don't get it, don't feel bad. Usually the person that got it is also pretty awesome. I think that's my recommendation. I think it's one of the best things in our society to help bring along young people. I think in the first couple of years of your practice, you're just trying to figure out where the bathroom is. And then I think as you start to understand surgery and yourself, then when you go back into someone's OR, you notice different things. It's not how to put in a pedicle screw. It's how do they manage the team? How do they, how they dissect, things like that. I remember I saw Larry operate once, and I was just amazed by his dissection, actually.
We all talk about how it'd be nice to go back and do a second fellowship when you're
100%.
somewhere between 5 and 10 years in.
Yeah.
And these are the perfect opportunity to be able to do that.
Agreed.
And I agree totally with Bob. You go to these places and you gain so much different information from being in the operating room after you've been out of practice on your own for a while.
All right, we're going to do a lightning round. So short answers. First one, best meal you had.
Oh, we went to this, I forget the name of it, but it was like a rooftop place in Philadelphia that like overlooked the whole city. It was phenomenal.
I have two. There's an awesome restaurant, multi-course restaurant called Provenance in Philadelphia that we went to. Sugan and I went to. It was amazing. Probably more heartwarming was his wife Sheila had cooked dinner at home at their house, and it was amazing. So
That's so true of traveling fellowships. The meals at someone else's home
Yeah.
are the most memorable ones for me.
Yeah.
Most surprising thing you learned?
Larry Lanky must be a robot because he doesn't eat or pee for like an entire day.
Stu McKenzie is an ATP molecule. He is 100% energy all the time. I started cycling about a year ago, and he's a big cyclist. And he would come to the house, and I'm ragged out of bed at 5:50, and he is like, "Hey Bob, how are you?" And I'm like, "Oh my God, yeah."
And one word to sum up your fellowship.
Life-changing.
Awesome.
Well, thank you both for sharing your journey with us today. It's inspiring to hear how these fellowships don't just advance surgical practices, but also broaden our perspectives in many ways. For our listeners, if you're considering applying for a traveling fellowship, hopefully this conversation will give you a sense of just how impactful the experience can be. And thank you both, Megan and Bob, for joining us. Best of luck as you bring these lessons back to your practice. And to everyone listening, Bob has one more comment.
Yeah, and if you are listening and you have been on one of these fellowships, I think it's really important to try to think about giving back. I think it's really important to try to give back. These fellowships cost the society a lot of money, and I think it's one of those things that if you have done it, it's probably reasonable to try to give money back to the society so others can do it.
I was going to interrupt Chris to say the same thing.
Yeah.
The Lori Karol Award is an initiative by the society to try to raise money for that. So if you know of her, if she's touched your life in some way, please consider donating to the fellowship so that others can live on in her legacy.
Thanks, guys. We'll see you all in the next episode.